This module will introduce you to a popular teaching technique called the 1-minute preceptor. Prior to the 1-minute preceptor model, research indicated that the typical clinical encounter between a resident and preceptor was about 10 minutes in duration. 6 minutes was spent with the resident presenting the case, 3 minutes were used for questioning, and 1 minute was allocated for discussion. The 1-minute preceptor was initially introduced as a 5-step microskills model for teaching in the clinical setting and is now a popular strategy used by clinical teaching faculty in the academic medical setting. Its popularity is largely due to its active engagement of the teaching and learning process in a clear, concise, and succinct manner. The 1-minute preceptor method involves 6 steps: getting a commitment from the learner, probing the learner for supporting evidence, reinforcing the learner on what was done well, giving some guidance about errors and omissions, the faculty teaching a general principle, and lastly, concluding the session. Getting a commitment from the learner involves pushing the learner beyond their level of comfort while making the teaching active and personal. An open-ended statement works best in these instances because it avoids the 1 to 2 word responses. For example, ask your learner, "What do you think is going on with the patient?" That works much better than, "So, you know what needs to happen with the patient." Another example of using an open-ended statement would be, "What other diagnosis would you consider and why?" This works much better than, "Have you also thought about diabetes?" A third example of an open-ended statement would be, "Based on what you know about the patient, where should you start?" This is more effective than saying, "Do you think we should go ahead and order the labs now or later?" Through this first step, you are complimenting when the learner is correct or on track, and you are making corrections with errors along the way. I will give you some examples of how to facilitate compliments and corrections later in this presentation. The process for Step 2 is similar to Step 1. The difference is, when you are probing for evidence, the learner has already made the correct commitment to the patient's diagnosis. Now you are expanding on their decision-making to further explore their medical knowledge. The same principles apply when using open-ended statements that you see here on this slide. Again, compliment and correct the learner along the way during the process. All learners need reinforcement about what they do well. An effective way to do this is to target specific behaviors and actions versus generic compliments. For example, saying, "Good job on that organized H&P. It was clear to me you integrating the patient's history and physical exam findings in the diagnosis." You could also say, "You did a nice job de-escalating the anxious patient. You told him in a calm voice why the procedure had to be done and he settled down quickly." These are both statements where the learner can identify what they have done well, thus reinforcing they will do it again. What wouldn't work in this process would be to make statements like, "Good work again. You are really doing a nice job." Or another example of a vague statement would be, "You got this. Now let's see the next patient." Step 4 is often experienced as the most challenging for preceptors to convey to learners. Oftentimes, what is essential in addressing errors and omissions is not so much what you say, but how you say it. Let's look at the first example on this slide. My hope is you would agree that telling a learner the following would not be an appropriate approach to take. "Really? You're kidding, right? I went over this with you in the last patient we just saw. You're not listening. Try again." Statements like these shut down learners and thus they build resentment to the learning process. With patient safety in mind, preceptors can set the stage for fostering an educational environment where learners develop a questioning attitude. Here's a better way a preceptor can make this happen with a learner who might be struggling with errors and omissions. "Tell me what you are seeing with this patient to make you believe that she is diabetic. I can see how you are thinking this through, but your treatment plan is not addressing the underlying condition. Think about what we just did with the patient, Mr. Jones, on the 5th floor. How can that be related in this case?" Step 5 involves teaching a general principle to the learner. As the teacher, have your learner walk away with a generalized concept or principle that they can utilize with another patient or experience. When learners can connect an actual current patient experience with a general principle, they are more likely to remember what you're teaching. It could sound something like this. Here's a general principle to consider when making a decision to admit a suicidal patient. If the patient can't state to you that they will not harm themselves, the patient needs to be admitted. The last step is the conclusion. We all know time management is necessary. You as the preceptor set the pace of the teaching interaction. The preceptor must define the role of the learner in the next steps. For example, you can say, "Let's do this. We'll go back in the room and I will reconfirm with the patient the concerns he has about feeling suicidal. Then you can start those admission orders and let the nurse know what we are doing. Any questions, comments, concerns before we go see the patient?" Work on making it a habit to ask the learner if they have questions, comments, or concerns before proceeding to the next step. This facilitates the learner being actively engaged in their own learning, and again, it promotes the questioning attitude that preceptors need to create, which impacts patient safety. Now that the 6 steps of the 1-minute preceptor model have been explained to you, take a moment to watch the 1-minute video on the next slide. If the 1-minute preceptor model is new to you, keep in mind it might feel more like the 5 or 8-minute preceptor model. The more you use the components of the model, the more second nature this will feel to you. Some practical takeaways that can help you along the way would be to first build a department culture of feedback. It's even okay to tell your learners you are learning some new teaching techniques, so it might initially feel a little different. Something that can help you as you learn these steps would be to create a cheat sheet for yourself so you can reference it back as you need to. Another tip is, don't think you have to learn all 6 steps and have them mastered the first time you start. You can try the steps one at a time and then build on other steps gradually. Lastly, ask your learners for feedback about your precepting skills. Taking this humble approach goes a very long way and reinforces to learners that you are practicing what you preach. Also, as you build on your teaching skills, this type of reflection helps you grow as a preceptor. To do this, you can ask your learners the following: what can I do to be helpful to you? Am I understanding you correctly? Is there anything else I am not thinking about?